First of all, I have an apology to make, right? Okay, because after all that really kind introduction, I am standing before you. I have no idea why I'm here, right? I say, well, that kind of reminded me of the very first TEDx that I was asked to do, right? About 4 years ago, I was approached by TEDxKL, and then essentially, in a very, very busy urology clinic, I received a phone call. The phone call goes like this, and then someone called me up and said, Professor Lee, is it possible, will you be interested in doing a TED talk? And it was so busy, the only thing I heard was, Professor Lee, is it possible if you can do a sex talk? Right. So, something that is supposed to be a TED talk that will change your life, and suddenly I misheard it as a sex talk. Right, okay, I'm a urologist, and therefore, I deal with sexual issues all the time, and therefore, I assumed this was a sex talk. So, throughout the few months, I received phone calls, like, saying, would you like to do a voice coaching, body, posture, monitoring, and I said, look, I do sex talk every single day, so I really don't need any coaching for this. So, the night before the actual TED Talks, TEDxKL, in OUG, I suddenly received a phone call when I was having dinner with my kids. So my daughter was in front of me, and then I received this phone call and said, excuse me, Professor Lee, you have to come here for a rehearsal. Then I said, look, I don't know who you are, but I do sex talk every single day. I know how to deal with that. And then I put down the phone. My daughter asked me, Dad, who's that? I said, someone called Ted. My daughter said, Dad, hang on a minute, T-E-D, TED. Like, this is like an idea we're spreading, and then it's broadcasted to 500 million people in the world. You are a penis doctor. Why would they ask you? I was like, TED stands for Technology, Education, and Design. It's like, which part of the penis doctor are you? Now I said, young lady, you be careful. Those penises pay for your school fees, okay? Anyway, I said, look, Dad can be quite techno-savvy as well. He said, Dad, come on. There was once we were in a restaurant, someone came to you and said, Professor Lee, can I do a selfie with you? And I said, what? Selfie? Now? Here? In front of my children? Right? I said, and then my daughter said, Dad, what are you thinking? She just wants to take a picture with you. And I suddenly thought, oh, selfie! So she really didn't know what I was thinking at that time when I was being asked what selfie was. Anyway, several years down the line, yeah, that's quite funny, right? Yeah, several years down the line, I become quite techno-savvy now, right, okay? This is a picture of me going back to Cambridge, right, okay. I am quite techno-savvy, so, like, you can see, like, Instagram Dr. George Lee. So because I got a bit hurt, my daughter told me that I actually was too techno-savvy. So I went for a jog with my son, and this is outside Senate House in Cambridge, 27 years after I graduated. And then my son asked me, Dad, stop, I need to take a picture. This was a scaffolding expert, it says erection specialist. And my son said, that's you, Dad. And I was going, right, okay. And then from my Monash University, students actually say, nice shot, Prof. And your name as well is there. You can see George is written there. Right, okay. Anyway, coming back to my TED Talk. So when I appear in front of 3,000 people in TEDxKL, suddenly I prepare a sex talk. So I suddenly got really worried because I suddenly thought, look, what exactly do they want to hear from me? Is it because of my pharmacological career in Cambridge? Or is it because of my transplant career in Oxford? Or is it because of Imperial College? Or is it because of my clinical associate professor role at Monash? Then suddenly I thought, you know what? They might just be interested in what I do. Because one of the things that I do as a urologist is actually learning from patients to find out why there is a differences between male and female treatment-seeking behavior. Because in many ways, many of you will know that life expectancy between men and women is markedly different. Because across the world, from Swaziland to Japan, you will see that men actually shortchange by women by at least 5 years in their life expectancy. Some of you might think it's conspiracy because all the women get together and say, kill them, right? But the reality is men seeking help, they always seek help a little bit too late. So when I turned up to this TEDx talk, I basically told them how I learned from my patient's experience in order to change, because I feel that that is a very important part of my career in order to find out why is there a treatment-seeking behavior between men and women, because I think mankind is not too kind to men. That's pretty good, right? Come on. Right, okay. Anyway, that TEDx went really well, apart from I was being told off for mentioning penises about 15 times. Right, okay. And then about 2 years later, I received another phone call. This time, it's TEDx Petaling Street. And then I was going, yeah, I know what to do now. I'm pretty techno-savvy. I've got Instagram. I know what to do. And then until I turn up, I said, I even want to give you the title of my talk. It's called The Gift of Fear. And they said, oh, that sounds really good. When I turn up, there were about 2,000 people. On this occasion, I suddenly realized that it's not the title or the topic I got wrong. Suddenly I realized that this is a TEDx in Mandarin. Right? I prepared a TEDx in English. However, facing with adversity, with the title of my talk, The Gift of Fear, I needed to face and confront my fear and deal with that adversity. And so I did it. Well, I guess some people call it bullshit with style, but I did it, right? Okay. But, oh, that's pretty good, right? Okay. Well, I'm from Kota Baru. I went to a really small Chinese school, and my Chinese is still not too bad, so I delivered the talk in Mandarin. And the crux of the talk, essentially, it's about my fear. It's about a fear that actually has been haunting me for years and years. I have this fear of death. Well, a lot of us have fear of death, but I have this really probably disproportionate fear of death. Because when I was a kid, my dad is a very superstitious man, worked out all these kind of like fortune teller things, and all of us had got all our little problems that we may face, according to my dad's fortune teller. And for mine, I was told that I was going to die on my birthday. And then so the interesting thing is that every birthday you wonder whether this is your last birthday. So, interestingly, the talk that I was giving was not about my birthday, it's about an experience I had. When I've been back to Malaysia for about 10 years now. On my 7th year in Malaysia, I had burglary at home. In the middle of the night, about 4:38, I remember it well because my face was pinned to the floor, I had 3 people came to my house. They basically tied me up, beat the crap out of me. Can I say crap? Sorry, I said it anyway. Sorry. Okay, right, okay. And then basically tied me up and then was demanding money. I had 200 ringgit at home. And at that time, I screamed and asked for my wife who was sleeping with my daughter to say, run. The first thing my wife did was I opened the balcony and jumped off. And then, well, it's not a very tall building, so she jumped off and asked for help. So I was grabbed down all the way to the kitchen, had a big parang in my neck. And then the only thing they decided to do was to say, bunuh lah. So that's a moment that I don't think any one of you would have experienced in your life. To say, in that final moment, what are you thinking? So that was what I was writing down and delivering in my TED Talk. When my daughter asked me, Dad, what exactly were you thinking? Of course, I told her, I was thinking about you, darling. Right, okay. But the reality was that the only thing I was thinking was that the week before that I had the burglary, I went to Petra, and then the only thing that flashed across my mind was I haven't been to the pyramids, maybe next time lah. Right, okay. And then strangely enough, that's a strange thing that came across, because at that time you knew it was going to be the last moment of your life, and then suddenly think of something else. So that was an interesting TED Talk that I gave. But the crux of the story was, at the end of that burglary, the police started taking statement, and then police asked me, is it painful? I had bleeding down my skull. He asked me whether it's painful. Right, okay. And then next thing he asked me was, did you lose a lot? I said, look, I lost a watch my dad gave me. And then they said, don't worry lah. In the other place, they killed the other guy, Come on, you only lost a watch. If you treat this as taxation, then you feel better. The last thing he said to me was that, don't worry lah. If you don't really like living in Malaysia, you always have a choice to go to Singapore. At that time, I was angry. I was really, really angry. For 6 months, I really was struggling because I was in fear. I kept thinking about wanting to go back to Cambridge. And I really was angry. Until something changed my life. One day, my son saw how depressed I was because for 6 months, I lived in hell. Constantly, I heard things. I lived in a bird cage that the shutter was shutting down every single night. And one day, my son said to me, Dad, are you still in pain? I said, well, no, not really, but I'm in fear. My son said, Dad, but the thing is, it's not that bad, right? We're still together. So it could be a lot worse. In reality, I was hearing different things when the police said it. The police said that, look, they killed the other guy. They didn't kill you. But when you hear it from your son, they actually said, it's not that bad, right? Because they killed the other guy, or, they didn't kill you, and you're still with us. And my son asked me a second question, did we lose many things? I said, I lost a watch that your dad gave me. It's a sentimental value. And my son said, maybe Granddad thinks that this will actually buy you your life. Maybe he knows. Therefore, he have to give this watch away to buy your life. So it's just like taxation lah, right? Okay. The last thing he said, Dad, if you truly are unhappy, then we can always move back to England. And that moment really changed my life because suddenly I realized that when you're faced with adversity or fear, or the fear of death, suddenly you can look at how unlucky you are or how lucky you are. And therefore, subsequently, we have been living in the same house, living normally. I'm actually quite happy something like that happened to me because from that day onwards, I live life very differently because suddenly I realized that I live life if this was ever going to be the very last day today, I might not see tomorrow again. Therefore, I make the full use of it and make it as rewarding as possible. Oh, come on, that deserves a round of applause, right? Then, TEDxMonash University called me and said, can you do another TEDx? Then I was just thinking, at that time, I was actually in Cambridge, and then I was actually attending a play. And then they said, what is your topic going to be, they asked me. And then I heard this, they said, let me embrace the sour adversity. 4 wise men say it is the wisest course. Suddenly I said, okay, I'm going to do this TED Talk. I'm going to call it The Power of Adversity. I'm going to tell you a last story that's going to highlight what I mean by that, okay? So the power of adversity, for the talk today I'm going to give you, is another problems I face in my life. You might think that I'm absolutely accident prone, right? Always end up in trouble. I'm going to show you a picture of me, right? Okay. This is, if any one of you actually look at my WhatsApp, this is a picture I put up. This is a bike my mom bought for you. I'm a 50-year-old, I still get gifts from my mom, right? Okay, that's quite interesting. It says DR9988, my mom bought this Vespa for me. I won't say I love biking, but this is something that I feel like I really enjoy. So, one day, I actually took this bike. I live in Mount Kiara, I work at Gleneagles, and I rode all this bike all the way to Gleneagles. And after seeing the patients, my ward round, this was only 18 months ago, I drove back, and then I said goodbye to patients, I drove back, and I hit a pothole. And I fell into the pothole, the bike landed on my chest, and I was lying in the streets thinking, this is it. It's not my birthday. And And I was lying there. The cars kept passing me. I was thinking, if I'm not going to die because of an accident, someone's going to crush me to death here. I better come up. So I woke up. I tried to kickstart the bike again. It didn't work. So suddenly, I thought I was going to Uber to the hospital, right? Okay. I picked up my phone. My phone was smashed. So what I did was that I actually just walked home, walked back to the hospital. It's 20 minutes walk. I kept walking back. Because at that time, the only thing I said, I don't want this to be today. And I walked back. When I was in accident emergency, I got a phone from my colleague and said, I need to call my wife. When I called my wife said, okay, do I have time to have hair wash first, or are you really that serious? Right, okay, right. I said, okay, right. I couldn't breathe. I really couldn't breathe. So I said to my colleague, guys, put me into the CT scanner. Then they said, no, you probably have a pneumothorax, which has punctured your lung. Let me put a chest drain in and everything. I said, guys, no, seriously. Then eventually, they're convinced. They actually put me through the CT scanner. They said to me, do you want the good news or do you want the bad news? I said, both, please. They said, the good news, if you don't have a punctured lung. The bad news is you just ruptured your spleen and you just torn your liver and you have about 1.5 liters of blood in your abdomen. So I said, okay, right, okay. They said, we need to push you to ICU. So, because we might need to take you to operating theater. So they pushed me to ICU. The patient I've just seen, I waved hi to her. And the only thing she said was, so who's going to see me tomorrow? Oh, come on, that's good, right? So I was lying there, and then I suddenly realized that I might die. Because my colleague came in and said, you have 30% chance of dying. At that moment, I picked up a notebook, I wrote down all my account number and passwords. I gave to my wife and said, enjoy your life. And she said, thank you. Oh, not bad, right? Okay. So, at this moment, I really was ready. I just kind of felt like, look, sometimes life is just like that. It might be your last day already. So you just have to accept it. So, for some whatever wrong reasons, you can just read any medical textbook. There's no splenic injury that does not need an operation. And suddenly, within 24 hours, my bleeding stopped. And then suddenly I could wake up. And then I was pushed to the ward. And I was okay. God knows what happened, right? The only thing that I found out was that I really was struggling because I was in pain. I was in so much pain because my lung was stuck to my spleen and I couldn't breathe. And when I was in the hospital ward, I fell off the bed because I suddenly realized that I have no use of my hand. I still have scar on my hands. I suddenly realized that I was in so much pain, but I'm alive. What should I do? Should I feel sorry for myself? Or should I move on? And that was a moment I suddenly remember a patient said something to me. A testicular patient said something to me to say, sometimes adversity in your life actually make you a stronger person, and it changed the course of your life. And that is something called the power of adversity. So I suddenly realized that the bleeding stopped. I was given a second chance. I stood up. I actually called my driver, went home, and told my wife that, look, I'm okay now. Of course, she was a bit disappointed. And then the following day, I went back to work. I started operating 2 days after I have splenic injury. And since then, I actually have not looked back. So, ladies and gentlemen, I started telling you a story about how adversity can change your life. This is a picture that was taken 2 weeks before my accident. I was 108 kilo at that time. Suddenly, this is a picture that was taken last week in my new Instagram. That's not my new wife. That's my fly cycle instructor, right? Okay. I have lost, I'm now 82 kilo, and I'm counting. I suddenly realized that I love my life. I begin to enjoy everything. I begin to change everything. And I want to leave you with something that I learned from my patient. In life, we're faced with adversity. And it's the strongest people that actually rise from all that adversity and make good use of your life and don't waste it. Just like what Victor Hugo said, adversity makes men and prosperity makes monster. On that note, thank you very much.